Hello ladies, right, welcome to tonight's live. This is all about iron deficiency, iron levels, iron deficiency, because there's literally millions and millions of people that suffer with this across the world, and you may not know that you actually are. So I want to highlight some of the symptoms, the causes, and potentially what to do about it, and give you some values. And Kate's book, this is my go-to blood woman. She takes my blood, she helps me understand my blood markers, my lab reports, and she's a really helpful person to know, a really helpful person and a good person to know. So first things first then, I've been experiencing low iron levels over the last, I'd say, I've felt it definitely for the past 3 weeks, but I think my iron has been sort of subclinical, not really shown up in a lab report, but definitely kicking about like a pre-anemic stage, like pre-diabetes, the stage before diabetes, kind of there. And I've been anemic off and on since I had Leo, even although my diet's really good. But my periods are heavy. They're heavier now than they've ever been. Obviously because I'm going through perimenopause. There's no fibroids or anything that I've got to worry about. I've had a full check, full scan, but yeah, so that takes away a lot of the iron stores that I build up. Anyway, that's me, but some of these symptoms, in fact most of these symptoms that I'm going to discuss, are what I felt recently, and it's awful. And when you feel anemic, sometimes you go to your doctor and your doctor might say stupid things to you like, no, you're not anemic. Worst case scenario is they tell you it's all in your head, which is, well, makes you feel even worse. But it doesn't show up in your lab report, so you're clinically not anemic or pre-anemic, and you're thinking, well, what is it then? Because I don't feel myself. So some of the symptoms are: you can't sleep, fatigue a lot. I mean, was it last week or the week before? I was practically in my bed what felt like 2 days. It was close to 2 days. It wasn't far off, and that's not me. Like, I'm a highly functioning individual, and everything I do is like full on. I don't really sit down much, albeit I sit down when I'm working, but I'm on my feet a lot. I'm very, very active. So basically that's not me. Arrhythmias, heart arrhythmias, brittle nails, brittle hair or thinning of the hair, restless legs, and a thing called pica, which is when you crave like the crunch, like usually it's dirt or excuse me, or ice, or even like clay. That's pica. Joint pain and muscle pain, I had that. So I had the fatigue, I couldn't sleep, remember. I was putting it down to jet lag after New York by Christmas time. But obviously I was borderline then. Heavy, no, that's one of the reasons, sorry. Every single one of those symptoms really I had. Maybe even see your nails become brittle or ridges on your nails. White pale skin, when you pull your eye down, should be quite pink, really quite pale inside your eye. So those are all signs and symptoms of anemia. But the worst thing for me was the horrendous tiredness and fatigue. But no matter how much sleep you have, doesn't fix it, doesn't make you feel any better. Also sort of confusion, brain fog, cognition problems, concentration problems. That's also a lot of the symptoms. So iron comes in two forms. There's heme iron and non-heme iron. So if you're vegan, then you would only ingest iron in the form of non-heme iron, and that comes from plants or pulses or beans or something like that. Whereas heme iron comes from your red meat and your eggs and poultry and seafood, And heme iron is by far the most absorbable. You will absorb far more heme iron and get much more iron from heme iron than you will non-heme iron. In fact, it's something like 10 times the amount of absorption rate between heme and non-heme. So for vegans, it's going to be really difficult for a vegan to get the iron that's required, and I'm going to talk to you about that in a minute. So when you do have a deficiency, it could look like and show up as a few things, and the first one is hypothyroidism. It could mimic a hypothyroid issue when it's really an iron problem, because iron is actually responsible in part for helping produce thyroid hormones. It could also look like a B12 deficiency. It could also look like a vitamin D deficiency. And also, would you believe, sleep apnea. So you might be anemic, not showing up in a blood test. So you're thinking, well, it's one of these, and you maybe even had a diagnosis of one of these. But if you've got all the rest of the symptoms, then please have a look at this and do your reading and do your research. So, green leafy vegetables and plants do have iron in them, but they've also got what's called oxalates or phytates. And phytates, for example, and oxalates actually, are blockers. They block iron. So whilst you're taking in plants, maybe as a vegan, let's say, or maybe us, we eat a lot of plants and a lot of leafy greens, so we think, oh, we're getting lots and lots of iron, but within those plants is actually something that's blocking the absorption of iron, and that's phytates and oxalates, for example. So and grains also do that as well. So the vegan or the vegetarian diet is much more likely to block. You might think you're getting lots, but you're going to block a lot of what you're eating as well. So you need to look at your iron levels if you don't eat seafood, red meat, eggs and what have you. Okay, fine. So here are the causes. So that was some of the symptoms. Here are some of the causes. So excessive bleeding, which is me, and that's what keeps me, tipping me over the edge. I build up my stores and then a heavy bleed wipes me out. So that's a bit of a pain. Ulcers. If you've got, you might not even know you've got an ulcer. Inflammation. Now, inflammation, you'll have inflammation hotspots, but if you've got chronic inflammation over time, because of, you might have an autoimmune condition, you might have a gut issue, you might have something else going on, and it's causing massive amounts of inflammation. The good and the bad bacteria, in times when you have got inflammation and in body parts that there is inflammation, they absorb and hold on to iron. So iron gets locked up with the good and the bad bacteria. Bad bacteria being pathogens. So they'll store up the iron, so you actually can't use it. And iron's carried in the blood and delivers oxygen to around your body, which is why another symptom actually is breathlessness. You can't really get your breath, or you're getting out of breath really quickly. It's because there's a lack of oxygen, because it's not being carried in the blood, because potentially if you've got inflammation or an autoimmune condition, for example, it's the good and the bad bacteria are locking up the iron and holding on to it. And that's even in infections. If you've got an infection or if you've got a fever, they'll do the same thing. They'll hold on to the iron so you can't access it for what you need it for. So if you've got inflammation and you've got, say, metabolic syndrome, and you've got lots of different health things going on, probably your iron's being locked up and keeping it away from you, so you can't actually access it because there's a lot of other things going on. Okay, so you just need to know that. So my anemia was like a pre-anemia or a subclinical anemia, and you need to know that that's possible. It might not show up on your blood test, but if you're having all these symptoms, then you need to look at it further. Okay, so your red blood cell count, you'll get a full blood count from your doctor, so your iron levels, your red blood cell count, but you'll also get a ferritin value, if you like. And ferritin really is a group of proteins that bind with iron. And if your ferritin is low, it could indicate that you've got low iron or iron deficiency. But what skews ferritin is if you've got an infection or you've had a cold or you've had something, it makes ferritin go up. So it could skew your results. So when you get your blood test, make sure that you're not going, if you're suffering from an infection, if you've been, ill with the flu the week prior to getting your blood test. Let that get out your system first before you actually do get your blood test. So iron is needed for a number of different things, lots of things actually. One is carried in the blood, and it's oxygen carries it around your body, so to speak, or your blood does rather, so it's needed for the blood. It's also needed for nerve impulses, which is why sometimes you get arrhythmias or cramps or pains in your muscles, which is what I was getting. Remember, we done a snatch technique, and one of our strength workouts, we were doing the snatch with the barbell, and for days and days after, I'm feeling it in my shoulders, and I'm thinking, that's surely no normal. I know I've not done the snatch technique for a while, but surely I can't still be sore. And then I was getting them in my legs, and I thought, nah. And obviously, it was my iron. Iron is needed to make dopamine, so which is why you sometimes go on a bit of a low. You're in a lull, you feel flat, you might even feel a bit depressed. And also helps build thyroid hormones. So if you don't have enough iron, then it will impact on your thyroid. So one of the reasons obviously is you're not eating enough iron. So you need to look at that, which you should be if you're following the plan. Seafood, meat, eggs, leafy greens, we eat everything. So there is nothing that you should be deficient in, unless there's an ongoing issue, maybe like you do bleed really heavily and you're losing a lot. Yeah, so that's the dietary angle. But if you've got another health problem going on, like I said to you, then it might be locking up your iron and you can't access it. Another reason also is malabsorption. You're not able to absorb what you're eating. So the great food that you're eating and all the iron, you've just got a problem with absorbing it in your gut and taking the goodness from your nutrition. And that might mean you've got low stomach acid, which is why I introduced to you an apple cider vinegar complex. So it's not just apple cider vinegar, there's lots of good things in there. So there's also, like Kate says the other week, there's a little bit of fat in there, so there's MCT oil in there to help you absorb it, because it's a fat soluble thing. But the acetic acid in my Activate supplement will help acidify the stomach so you could pull the goodness in. And it's very important, especially with if you've had a poor diet for a lot of years. Maybe you've had stomach issues or gastro issues or gut issues that you maybe don't even really know about, to be honest, but you've noticed a distension in your stomach, you've got a burning and acid reflux situation going on, maybe you've had ulcers, loads of different things, then it could be an absorption problem. Okay, so that's pretty straightforward enough, isn't it? I think so. Now if we go over to Kate's book here, which is really useful, this is her guide to interpreting blood test results for fatigue, and there's a section in here specifically on iron, and she gives you lots and lots of different she gives you the data in terms of if you get your blood test done, where your iron should be and what's deficient and what's in the ranges that are seen to be normal. But remember, it's kind of tricky when your blood tests show you as maybe even optimal, but you've got all of these symptoms, so you might be just anemic or like pre-diabetic or something similar. So you have to bear all that in mind. It's a bit of a minefield, your bloods and your health, because it really takes you to be absolutely curious and proactive and tapping into your body and how you feel and connecting that with what you've been doing, what you've been eating, how you're living, So it's not just something that you could take lightly. You need to go deep on this stuff, and this is just a tiny wee part I'm sharing with you here. I need you to be as on the ball as you possibly can be. So, what was I wanting to read out to you here? She's got the symptoms, the causes. Right, okay, so diet to improve an iron deficiency. Recommended daily intake is this. For males, it's 8.7 milligrams per day. There's no males on this programme. For a perimenopausal female, i.e. me, I need 14.8 milligrams, and I'm going to help you decipher how many milligrams are in certain foods in a minute. So I need 14.8 milligrams. So I need to make sure I get that. But am I able to absorb it? I might take it in, but am I absorbing it? Which is why my Activate supplement is very important. And you'll get it on the shop if you want it. You just go to my website, there's a tab with shop, and everything is in there. All the programs, all the supplements, everything is in there. Females that are post menopause, you need 8.7 milligrams, so roughly half. On average, she's saying here, around 10 milligrams of iron is consumed per day, of which between 2% and 35% may be absorbed. The absorption rate is higher for heme iron, as I've just said to you, and increases for both heme and non-heme iron when iron levels are deficient in the body. Strongly recommend that the client reduces intake of foods that inhibit iron absorption, such as, she's got dairy here, which is fair enough, high fibre foods, so all of the foods that you may eat predominantly as a vegan, pulses, beans, obviously plants, tea, coffee and green tea she's got here. So if we need either 14.8 milligrams or 8.7 milligrams, depending on where you are on the spectrum of the menopause, 200 grams of beef, minced beef, there's approximately 3.8 milligrams of iron in there. 150 grams of chicken livers, so I don't know if you eat them. I don't, but you might. There's 17.4 milligrams, so you're getting your daily intake and some within those chicken livers, 150 grams. 1 tablespoon of blackstrap molasses, 2.8 milligrams. We don't have that, but you might in cases like this. 10 dried apricots, which is a lot of sugar, 1 milligram of iron. Not very much. But look, you can see where spinach is 2.7 milligrams. Red lentils has 14.2 milligrams. So lots in red lentils. So you would think vegans have got it made, but remember the absorption rate is much, much smaller. 1 teaspoon of cumin, she's got 1.3 milligrams. But eggs and red meats and seafood, you're going to get a lot of heme iron, absorbable heme iron. Okay. So the recommended dosage for iron in the UK for resolving iron deficiency anemia, and I actually got an iron infusion yesterday for the first time in my life at a clinic in Dundee, which cost me £500. Not cheap, but apparently the iron that they use, I know that people travel for it, and I would have had to go to London for it, purely because I knew I'm coming to Thailand, I'm going to be training a lot, I'm going to be doing a lot of exertion, I need to be, you know, on it, I need to feel not tired, not depleted, so it was important for me that I done that, and it's important for showing up for you lot also that I'm not tired. So for me, that was a business expense, and that's important that you hear that too. That was a business expense. I cannot perform in my job when I'm tired and I'm low on iron. So if there's something I can do to help me, then you better believe I'm going to do it, if it's healthy. So the recommended dosage for iron in the UK for resolving iron deficiency anemia is ferrous sulfate. And actually I bought that when I was in London. or ferrous fumarate. So 1 to 2 tablets, sometimes 3 per day. But forms may cause digestive issues, which is the problem with iron. It also makes your poo black for a reason, and absorption may be low. Consider a ferrous biglycinate, easily absorbed with minimal irritation. The following are available in the UK and from health food stores online. So she's put here Nutri Advanced Ferridyne, which is what I got, and that's 1 a day for 60 days. Or Terra Nova Easy Iron, 1 a day for 60 days. Take it before a meal and ensure the meal is low fibre, dairy free, and avoid tea, coffee and green tea. Okay, right, that's iron pretty much in a lot of depth, but it's just a starter for 10. This is to inform you, to make you realise actually we could change things really easily. You can, and information is so readily available. It's in the palm of your hands, but sometimes it takes for me to bring it to you to make you curious, and it also takes for you to join up the dots, because you might think, well, I've got 5, 6, 7 or 8 of those symptoms. Never had my blood test taken recently. Actually, I've had those symptoms for a long time, and maybe I'm anemic. Maybe you are. But imagine if you weren't. Imagine if you had your vitality back and you weren't sleepy all the time and you were able to jump out of bed and want to do a workout. That would be amazing, wouldn't it? Well, that's what should be happening. That's not a luxury. That's a given, that you should feel like that. And if you don't, you need to get curious as to why. Okay, I hope that was useful, everybody. I will monitor. I'll get my blood test done again in probably maybe 8 weeks or so, maybe a bit longer, and I'll see what my iron's like, and I'll see if the infusion was good. And yeah, today I feel great. I feel really good. It'll take a lot longer, and when I say a lot longer, it could take up to a week to feel the benefits of the infusion, but I feel great today, so glad I done it. Take it easy. I'll see you in Thailand, okay? I'll see you on the other side. Yeah, I'll see you soon. Yeah, I will see you soon. In fact, I'll see you tomorrow night at 7. I'm still working out the times in my head. I'll see you tomorrow night, your time, at 7 p.m. as normal, okay? And like I said to you before, sometimes when I'm out and about, remember I'm going to, the main reason I'm going is to bring my dogs back. I've been, I rescued 2 strays last year, 2 puppies from the jungle last year, and I found a doggy home for them, and they've been getting housed in there ever since. So I'm going over to, I won't find a family for them, I don't think. That's a long shot. If you want a dog in Thailand, you just need to go out to any street and you've got an abundance, you've got your pick of any dog that you want. So generally I'm not likely to find a loving family that want a dog, because they've probably already got one or they don't want one. So there's that. And if I don't find them, if I don't find a family, they're coming home with me. So I have a lot to do, but I might have to be at appointments and things, so things might change slightly whilst I'm away, but just be reassured, you will always, even if the time does change for the live, you will still get your live and it will be on the page, right? So just work with us here and know that everything I'm doing is live. And I committed to the whole year of doing lives, which means travel, and sometimes things happen. It's real life. So I'm sure you get that, and I'm sure you understand that, and you're open to that too. So lots of love to you. Be your best selves, you gorgeous lot, and I will see you tomorrow. Take it easy.